I was born in rural Alabama, Thomaston, Alabama. I grew up in this small town with a population of 900 individuals and one traffic light. I was raised by my great-grandparents. My great-grandmother was the help for a local family in Thomaston, and my great-grandfather worked for that same family, but he was the gardener.
It was the 1960s, and segregation was a way of life.
There were two high schools there, a black high school and a white high school. And when I was a senior in my high school, that is when desegregation started.
Dr. Wooten was determined to have a career and take care of herself. She graduated valedictorian of her senior class and attended Spelman College, a private, historically black college for women.
I often say Spelman was the best 4 years of my life. My intention was to get into medical school at Chapel Hill. I had friends in Chapel Hill, so that was my goal. But it was much easier and less expensive if you were a resident.
Over the next year, Dr. Wooten earned a master's degree in public health. She then went to medical school at University of North Carolina, Chapel Hill, completed a residency at Georgetown in Washington, D.C., and headed to San Diego, where a residency in preventative medicine led to a faculty position at UCSD. After 11 years, she was ready for a new challenge.
I've always known that doing one-on-one in medicine is just that, it's one-on-one. I wanted to do something that had a greater impact, focused on population health. And I saw coming to work for the health department as an opportunity to realize that interest.
That was 2001. By 2007, Dr. Wooten was promoted to County Public Health Officer, and San Diego was hit with wildfires.
I remember spending the night in the EOC, sleeping in the break room on the couch. When you have wildfires, there's a lot of smoke, so people with asthma, heart disease, other lung disease, they are impacted by that.
The county's public health challenges just kept coming.
So then it was measles. Then the next was H1N1. This is a novel influenza virus, a virus for which people do not have immunity. And we had a press conference for several months every day on the steps of ASCU to give the community an update about H1N1. Then the next was the meningococcemia group B outbreak at San Diego State. Hepatitis A was impactful to the homeless population, but there was a big spotlight on the homelessness situation in San Diego. So that reason it became political. And then obviously with COVID-19, when you lock down a jurisdiction or location, everyone is impacted.
Dr. Wooten became the voice of the pandemic, navigating political, emotional, and logistical challenges while managing concurrent outbreaks of E. coli, Shigella, and Mpox. Her leadership helped save many lives.
When you are faced with adversity and opposition, stay the course and do what you know is right to do. I am proud of our response to the major public health incidents and threats that we've experienced over the past 2 decades.
And what does she feel is her biggest accomplishment?
That's like asking which is your favorite child. It's very difficult. I am very proud of the fact that we are an accredited public health department. I am definitely proud of that.
After retirement, Dr. Wooten has no plans to slow down.
There are things that I am personally interested in that I call right brain activities, and I will be spending more time on those type of activities. Travel is at the top of that list. Traveling with friends, going to different places that I have not been to before. But in terms of what does the future hold, I don't know. But I'm excited to see what it holds.
Thank you, Dr. Wooten, for 23 years of excellence in public health.